All right, there's our new ultrasound machine.
All right, so we'll just show you some of the basic movements of the system first. So
Okay.
down here, you have a central brake. So no more brakes for each wheel. Just pop that down, unlock and lock.
Okay.
Right here on the console, there's a button on this side, same button on the other side. So if
Okay.
you just push and hold it, you can swivel the console.
Oh, look at that. Okay.
Yeah. All right, and then up and down arrows too for the console. So this will go quite high
okay.
and also low.
Okay.
And then you, of course, you have your swiveling arm as well. And you can muscle the monitor up and down a little bit if you're getting a glare.
Okay.
Like that. Okay, so those are the basic movements. So right here, power button right here to turn it on. When you turn it on, it will go to the scan screen, so you'll be good to go to scan. Right here is your probe menu. So all this is very touchscreen based.
Okay.
Probe right here, so if you need vaginal, just touch it right there. We'll go back to abdominal. And these should always be in the OB presets.
Okay.
If you need to expand this menu, you can drag down.
Oh.
You typically shouldn't need to because it should be in OB, but for any reason you need to, you can just drag it down.
Okay.
This routine preset will be ideal for most of what you're doing. So that's kind of the go-to right there.
Okay.
If you need to go to penetration, you just tap it right here. Those are for the harder to see patients. If you need more penetration, this is a big one to go to right here.
Okay.
Okay, so speaking of penetration real quick, this augment button, that's a simple on and off, also a penetration tool. So you can be in any preset here, hit augment, and it'll help you to see a little better if you're struggling to see.
Cool.
Okay? And it also keeps resolution quite well as penetrating. Okay, so as far as the buttons down here.
Wait, so do you do penetration and augment at the same time?
You can,
okay.
yeah. So you can stay in routine if you want and just try augment.
Okay.
Or you can come here. Okay?
Oh,
It's
I
not
see.
dependent on any preset. You can be in whatever you want and
I see.
still come here. Yeah.
Cool.
Good question. Okay, so on some of the buttons down here, so your freeze is right here. Here's your P buttons. So we have P1 set to print.
Okay.
So every time you hit P1, it'll print out on the side printer right here.
Okay.
And we have P2 to save an image if you ever need to save one. So in saving an image, you will need to start an exam, or else it won't save. So to do that, if you need to, go to the patient button. You can get here if you need to input anything. It'll automatically generate a patient ID for you. Feel free to keep that. You can fill in whatever you want or not. And right here, like filling in estimated due date, if you need to do that, if you're doing biometry, this is where you go to do that.
Okay.
And a digital keyboard will come up right here for that.
Okay.
From that point, there's start exam here, the top key of the trackball, or here. I'm just gonna hit the top key and you're good to go.
Okay.
Okay. And so as far as some more of the controls right here, some big ones that will be most useful. This knob right here does depth and zoom. So if you see this little up to down, so if I click it up, it goes shallow. Down, it'll go deeper.
Okay.
Twisting it will zoom. So if I twist to the right, that'll zoom the image right here. Okay. Your 2D knob, that is your brightness. Same as your prior ultrasound systems, what you're used to. So if you crank it to the right, that'll go bright, left, darker. Okay. Color box. So this is C, the color for color, PD for power. So if you click down on it right here, you'll get a box right here if you ever need to see color. I'm just gonna crank that to the right just so you can see something. Or there's your color box and you can move that around.
Cool.
Okay.
How do you like expand it to like be wider or narrower or whatever?
Good question. So we'll pull that back up. So this top key says change. We're gonna get back to that as well.
Okay.
So hit the top key, it'll go dotted, and then you roll your trackball around. That's how you move the size and shape of it.
Cool.
And then you just hit change again to go back to moving the entire box around. So anything with a box, you can do that. So same with power, same thing. And then there's M mode and pulse wave. So if you're ever wanting to get a heart rate or hear the heartbeat, just click down on the PW, put that gate right where the heart is, and then hit either one of these side mouse keys. Think of them as that. Hit that, and then it'll run. And if I freeze, it'll automatically go into heart rate for you. So it goes by 2 cycles. So say you find your wave here, skip a cycle, go to the next one every 2 cycles, and then you can set it there.
Cool.
Okay. Yeah. Okay. And there's this auto button here. That's just also another tool where if you're struggling with your image at all, you can hit this auto button and the system will basically try to optimize the image for you.
So what's the difference between augment and auto?
Yeah, so auto is a little more fluid. So the system, it gauges like where you're at in your image. Say if you're too dark or too light, and you hit auto, it'll try to adjust for that, like go darker or lighter, things like that. That's one of the common things it does.
Okay.
Augment it kind of does the same thing every time. Just it's an algorithm to penetrate no matter what you're doing.
Okay.
So and so let's go to measurements. So right here, the center key right here. So if I hit measure there, I just want to show you the measurement menu. So it's going to default to 2nd and 3rd trimester. Here's biometry right here. And then if you want to go to, here's subcategories. So these top 2 are your go-tos for what you guys are doing. So you go to AFI.
Yep.
And there's your quadrant right
cool.
there. So I'll just do an example. So if you do quadrant 1, again, you just use these set keys right here. Oh, it says set. It'll kick you right into quadrant 2. So you don't have to push the calc button every time. It'll kick you right into the next quadrant. Okay. So I said I'd go back to that change button. So if I hit this and say any measurement you take, if you don't like where you put your first caliper, there's that top key, that change button. I hit change and you sit there and toggle between the calipers.
Yep.
Okay.
Is there a way to split the screen into 4s and then like, you know what I mean? Like, and then like do right upper quadrant, left upper quadrant, you know?
Yep. Yeah, absolutely. So here's this
I see.
little button right here. So that's dual screen. This is quad screen.
Okay.
So you just hit that.
Yes.
Get your quadrant. Hit it again.
And then you can do your AFI that way. Perfect.
The more you hit it, it'll just cycle through your images. You'll see it light up green. So if you do your AFI that way, I strongly recommend just getting all your quadrants first.
Right.
And then doing your measurements.
The measurements, yep.
Yeah, after you get all your images.
Excellent.
Okay. And from there, I'll go to the report page right here. So there is this specific report button. That'll be where all the measurements you take go. Okay. So if you want to go to report, if you want to print it out, just hit P1. You'll print out that report page. So if you do take measurements, it is best practice to hit the end key when you're finished scanning the patient, because if you don't, the next person who comes in, if they use it right after you,
it's a continuation.
Yeah, the previous patient's measurements will be in there, so they'll get all mixed up.
Okay.
Yep. So that could be one thing to check as well. If you start and if you're at a scan screen and start scanning a patient, you could just quickly go to the report just to make sure nothing's in there from the previous person. And if there is, just hit that end key and it'll erase
Love it.
Okay. If you ever need to type anything, ABC button right here. So there's a bunch of preset annotations right here that you can scroll through if you need to, or you can just manually type what you want there.
Cool.
Okay. Trying to think if there's anything else that could be useful.
I know with other ultrasound machines that I've done, like it has like 2nd, 3rd trimester. Is that, and then there is like, I want to say it's, I can't remember if they label as routine, but I remember there's like 2nd, 3rd trimester.
Are the imaging presets?
Yes.
Yeah. So on these new systems, they just didn't name any 2nd and 3rd trimester.
Okay.
That's where the routine comes in.
Okay.
That's where this one should be the best go-to for a second, third trimester. That's what it's optimized
So
for.
basically routine and penetration. What is this routine res?
Routine res, you can use that. So it's similar to routine, but the frequency level is higher. So I'm assuming most of the patients you're seeing are third trimester, right?
Yes.
You're doing scans on.
Yes.
That's where routine is a lot better, because routine res will probably not give you enough penetration that you need.
Okay.
So a little less penetration here, a little more in routine.
Okay.
Okay.
And then in terms of, oh, okay, I see. So, because like a lot of the time the transvag is not there, so
yeah,
we'll just.
And if you want to go over unhooking the probes, it's the same as your previous machine.
Yeah.
Just
Right.
twist the knob.
Right.
Bring it out. Yeah. Bring it back in and lock it.
Cool. I can't think of any other questions. That was super helpful. Thank you.
Okay. Thank you.